Before the YMCA's diabetes prevention program, I would drink about 2 liters of soda a day.
Before I found out I was pre-diabetic, I would just eat everything that came across my plate.
I had very high blood pressure at one point. I had high cholesterol. I tended to work a little too much and to eat late at night when I got home.
Trying to fit in a healthy lifestyle has been a real struggle to me. I realise that work is important, but I'm important too.
As a busy physician, you're now seeing hundreds of patients coming to you with diabetes, and even more that you're going to find out have prediabetes in the next several years.
With 26 million Americans diagnosed with diabetes, there's no denying the magnitude of the problem and the impact this places on our patients, their families, and the burden on the healthcare system as a whole. We expect the number of diabetics to double within the next 25 years.
As our country deals with this growing health crisis of diabetes, there are huge costs at stake in terms of how much we're paying for medication, how much we're paying for health resources.
We have the conversation with our patients in the scope of a 15 to 30-minute visit. It's not enough time to really incite behavioral change.
As physicians, we often tell people you've got to exercise more and eat better. But us saying that and a person doing it are two very different things.
I thought my health was pretty good, but then I went to the doctor, I did my physical, and that's when he told me that I was pre-diabetic. I thought it was a death sentence.
Often when they find out they have prediabetes, they're really devastated because it may even seem that they're destined to become diabetic themselves. That is not true. When I meet someone who has prediabetes, I get really excited because this is an opportunity to really change the course of their health.
The doctor explained this would be an opportunity for me to not just delay the onset of diabetes, but perhaps even prevent it.
In 2002, it was published in the New England Journal of Medicine that, in fact, you can prevent or delay the onset of type 2 diabetes through a lifestyle program.
The YMCA's Diabetes Prevention Program is a year-long program consisting of 16 core classes, meeting 1 hour once a week with a group and a qualified health coach.
Once the 16-week cycle is over, once a month thereafter, the group comes together for reinforcement education.
So often as physicians, we're trained extensively in the diagnosis and treatment of disease. What falls to the side sometimes is prevention.
We're going to move into how to really work on taking in less fat. The two main goals of the program that we work on through the course of the 16 weeks is to lose 7% of their starting weight and to increase their physical activity to a minimum of 150 minutes per week. Every week when they come in, the first thing that we do is we take their weight. Their weight is not shared unless they choose to share their weight.
I was really excited because I reached my goal weight first.
If you can get your trackers out.
When we go to the sessions, we track our food intake every day, we track our physical activity every day, and we hand this into the lifestyle coach, and she comes back to us and gives us hints on how we can improve.
Little tips like if you're ordering salad, order the dressing on the side. When you order a meal, cut it in half immediately to take half of it home.
Watching the type of food you take in is going to also make a difference in the calories and the fat.
When they come into this group-based format, they seem to bond with the other people in the group. And I think it's important for people to see that they're not in it by themselves.
As a team, we've developed together, we've learned together, we make choices together.
Because you don't go to the buffet all the time.
I needed other people with me to see that other people are going through the same problem as me.
That's good, guys.
The YMCA Diabetes Prevention Program is the best possible option for patients.
This program is what we've been waiting for.
The YMCA's Diabetes Prevention Program is an opportunity for you to refer these patients who have prediabetes early on and let them really engage in their health.
The best part is the feedback from the patients themselves. The fact that they are able to take control of a part of their care is important and is a great upsell for physicians.
It's really improved my clarity of thinking, it's made me much more self-aware and more self-confident that I can actually stay on this particular program of Change for Life.
The program hasn't been a diet for me, it's been a lifestyle adjustment. It made me feel better, it made me feel healthier, it made me feel stronger.
you can take control. The YMCA's diabetes prevention program really said to me, stop making excuses, do it now. My doctor's going to be really happy when he sees me the next time.
I feel really good about myself, and I'm not scared anymore. I know I could beat this, I did beat it.
One of the benefits that you have as a physician is that if you refer your patients, you'll actually get follow-up to see how your patient's doing. This is really useful information to you as you continue to see your patient and encourage them to maintain their healthy choices.
Our patients here at the Grand Concourse have benefited greatly from this resource. I encourage you to also refer your patients to the YMCA's Diabetes Prevention Program so that they can experience these benefits.
To see some nurses and to see our health educators who have gone from, are you sure we can send them outside, and are you sure this is going to work, to being completely sold on this program. It works, and you can't beat that, an institution you trust in a program that works.